it's really quite clear now that the prognostic significance of end of induction PET after first-line immunochemotherapy for follicular lymphoma is firmly cemented. It is now the gold standard imaging modality for response assessment after treatment. And we've shown that in the initial hypothesis-generating PET and PRIMA study, in the Italian follicular lymphoma and the French follicular lymphoma studies, and then in the pooled fold analysis of all three studies. And then finally, what's really cemented it is having more than 600 PET scans at baseline in a protocol amendment of the GALLIUM study. And we're all very familiar with the GALLIUM study, which demonstrates the improved progression-free survival of obinutuzumab over rituximab-based chemotherapy. And we did a protocol amendment whereby 170 patients minimum had to have a PET scan at baseline and end of induction, and we ended up with 609 patients with a baseline PET, of whom 98% had detectable lesions. So the first very clear message that we got from the GALLIUM study is that while it is not uniformly glucose avid, follicular lymphoma is universally an FDG avid lymphoma. Now, 519 of the 595 patients who were PET positive had an end of induction PET that could be evaluable using the Lugano 2014 criteria. So the current imaging criteria, which we updated from our original study protocol, which was using the 2007 criteria. And these PETs were evaluated by an independent review committee. Of the 519 patients, 450 achieved complete metabolic response. So 76% of the patients who started induction achieved complete metabolic response. But the CMR rate was 87% amongst those in whom we had an evaluable PET scan at end of induction. Now, in these patients, we have a median follow-up of more than 6 years, 76.5 months. The patients were evenly distributed between those who had obinutuzumab and those who had rituximab, with balanced baseline demographics between the PET, the non-PET, the obinutuzumab and rituximab populations. And achieving a complete metabolic response was associated with a substantial and significant improvement in progression-free survival compared to those who failed to achieve a complete metabolic response. So we had a 5-year investigator-assessed PFS of 70% for those who achieved CMR, compared to only 29% for those who failed to do so. And so those who failed to do so had a 3.4-fold increased risk of progression or death. So that was the key prospectively acquired message from this large study using obinutuzumab and rituximab with either bendamustine or CHOP or CVP chemotherapy. So using modern immunochemotherapy approaches. So not only was CMR associated with improved progression-free survival, in this indolent lymphoma, where patients probably have a median 15, maybe even 20-year overall survival nowadays, we also were able to identify at this early time point a significant improvement in overall survival, with a 92% 5-year overall survival for patients who achieved CMR, compared to just under 80% for those who failed to do so. So this 12% difference in 5-year overall survival is really quite significant. And again, the hazard ratio for death in the patients who failed to get CMR was 3.3. Now, the end of induction response didn't differ very significantly between those receiving obinutuzumab compared to rituximab. The overall response rate was 84 compared to 79%. But the PFS was definitely better, as in the GALLIUM study as a whole, in those who achieved obinutuzumab chemotherapy getting complete metabolic response compared to those who were receiving rituximab chemotherapy. However, the overall survival was the same at 92% in patients who achieved CMR, regardless of the antibody that they received. So to summarize, we have now shown in 5 studies that achieving complete metabolic response is highly prognostic for not just progression-free survival, but also overall survival for these patients with this otherwise indolent follicular lymphoma. And so further studies are now needed, and we are engaging with PET investigators from other studies to do a surrogacy analysis to see whether PET could potentially be a surrogate endpoint for progression-free and overall survival for patients with follicular lymphoma.